Hi, it's Dr. Ghani from the University of Michigan. I've heard a lot of you have questions about stents, so I'm here to answer them. Two types of stents. One's made of polyurethane, a common plastic, and the other one is silicone. Stents are plastic flexible tubes that sit between the kidney and the bladder. They are around 26 centimeters long on average. There are no restrictions when you have a ureteral stent. We don't prevent you from doing anything. Some patients know they have it and it's very symptomatic. Some patients don't have many symptoms. We don't know who gets it and why, and this is still an area of research. You can do anything you want, but be aware that the more you do, the stents can rub your bladder and rub your kidney and lead to blood in the urine and sometimes some discomfort. So we ask you to find out what works for you. We get this question all the time. If you're coming with a stone in your ureter, the stent is not as painful as the event that you had, and that's my experience. However, if you're coming with a stone in the kidney and you often don't have any pain whatsoever, then I would say that the stent does hurt more than the stone because your stone is not causing any pain. We find, and we've done studies here at Michigan about this, that patients report symptoms and pain with stents for the first 4-5 days, but after the 5th day, they start to report a really manageable level of pain where it doesn't interfere in their activities. You can have sexual intercourse with the stent, and like I said, there are no restrictions whatsoever. However, you just need to be mindful that the more active you are, sometimes you might see more blood in the urine, and it may lead to some urinary urgency. We give you medication for this, what's known in the business as an anticholinergic medicine, which is a bladder agent to stop the bladder from contracting. We give you a relatively low dose and you only take it for the period of the duration of stenting, which on average is around 7 to 10 days. So this is what we do to combat those symptoms of urgency. The other thing I would say to you is that it's classically told patients to drink when you after this operation. Well, I've heard from many patients that actually the more I drank, doctor, the more I had the urgency. So what I would tell you is drink to thirst, don't overdo the drinking, just have a healthy intake of fluids.